Hey everyone, OTDUDE here. Hope you're all having a nice day. Today I want to talk about acute rehabilitation, where I primarily work, and the team that's usually involved in the care of patients on this unit. Acute rehabilitation is sometimes referred to as ARU for short here in the United States. And basically, patients who get admitted to this unit usually stay for a longer duration than they would in acute care in the hospital, where they're more likely to get discharged when they are stable. In acute rehabilitation, they're expected to have a longer, basically, duration of rehabilitation before they go home. And that's primarily the goal of acute rehabilitation, and that's to discharge patients to the home in their community. And I want to talk about basically the team that's involved in ARU and where I work primarily. So here on the screen, you'll see some examples of who's involved on the ARU team. By the way, this is not an all-inclusive list, but some examples that I thought of that come to mind for most common professions that work in the ARU. So at the top, you'll commonly think of the doctor, and a physiatrist is someone who specializes in rehabilitation compared to other doctors, say hospitalists or other specialists, say oncology. A physiatrist specializes in ARU, so you'll typically find a physiatrist kind of leading the team. You can think of them as the hospitalist for ARU in a way. They kind of are at the top when it comes to when you ask for orders. That's not to say that the physiatrist is the only doctor that works in ARU, but they're kind of like the most kind of the one that ties everybody together. So you may see other doctors and specialists as well, right? So let's say they have a cardiac condition and a cardiologist may follow them. Let's say they may have problem with voiding, then a urologist may follow them as well, and so on and so on. Then you have your nurses, so nurses and nurses support staff as well, so CNAs, care partners, that kind of thing, and pretty self-explanatory what nurses do. They support the overall team, and they do things such as medication management, helping maintain skin, bowel and bladder, safety, caregiver education for things such as insulin, whatever it may be. Social workers and case management. Typically in ARU, we have meetings with the social worker and case managers, and they help facilitate the care and discharge plan for the patient. Other allied health professionals, it's kind of a broad term, but this includes anyone, say, from EVS or janitorial to delivery to cafeteria to dietitian to basically anyone that may be involved. And this really varies with the patient and primary condition as well as other comorbidities that they may have, and depends on what they need. If they need respiratory therapy, then they may be involved in the team. But if they don't, then they're not. The patient and the family are also important, right? So, and looping in the patient and the family in the discharge plan from day one is very important so that everybody's on board and it facilitates the patient's discharge and their independence in the community after the ARU stay. So I'll go over the three common therapists here in the United States, and they're physical therapy, SLP or speech therapy, and occupational therapy. Now, these are the three most common therapists I talk about these because they're on the team, and here in the US, Medicare under CMS, they mandate basically a 3-hour requirement for therapy. So for a patient to be able to be eligible or to stay in the ARU, they must be able to tolerate and also receive 3 hours of therapy, and that's any combination of PT, SLP, and OT. So typically, let's say a patient who has a stroke, they may receive PT, OT, and SLP, and any combination of that. So for a patient to be eligible to receive rehabilitation in the acute rehab unit, they must be able to tolerate and receive 3 hours of therapy in any combination of PT, speech, and occupational therapy. They may need all three, such as physical therapy, speech, and occupational therapy, or they may just need two, such as physical therapy and occupational therapy, or as another example, speech therapy and occupational therapy. But those therapies added per day, the patient must do basically and be able to tolerate 3 hours of it. So an example most common is, say, 1 hour of physical therapy, 1 hour of speech therapy, and 1 hour of occupational therapy. Let's say that the patient does not receive speech therapy and they have no needs for communication or dysphagia, for example. then they would receive, say, 1.5 hours of physical therapy or 1.5 hours of occupational therapy. Or let's say the patient is, they typically what we call walkie-talkies and they don't have trouble with ambulation and strength in terms of their, for example, lower extremities or lower body. Then they may just need occupational therapy and speech therapy. Then they may receive, say, 1.5 hours of speech therapy and 1.5 hours of occupational therapy. Another common question that I get from family members and patients is, well, what if they are not able to meet that 3-hour requirement? And so that means that a patient can get some passes, right? So if they're not feeling so well, they're kind of sick, let's say they're really nauseous one day, or they're just having a lot of pain. That's not to say that they're going to get dropped from the program, say if they don't go to therapy on Tuesday, right? We have what's called a medical exemption, and that basically allows the patient to be able to miss out on some period of therapy for being sick or ill or whatever reason that falls under this category. Typically, it's for being sick or having too much pain, and there's special language and requirements for this. But that's basically if a patient doesn't feel too well, they may not be able to tolerate, say, physical therapy for the day. That's okay. Or they're not able to tolerate speech therapy. That's okay. The overall trend is they should be able to tolerate those 3 hours. So I hope that really helps. But I'll go over a deep dive into this topic more in future videos. So make sure you subscribe to this channel for more of this type of content. I'm Jeff, the OT Dude, and I'll see you in the next one.